Hi friends, I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you about phase 1 versus phase 2 treatment in terms of TMJ disorders. As you can imagine, I get a lot of questions about treatment for TMJ disorders, what it consists of, what order it's done in, how long it all takes, and more. I truly hope this video helps answer some of your questions, my friends. That being said, if you're looking for more information on TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Be sure to hit that subscribe button as I post a new informational video every Friday, specifically for people who are suffering from TMJ disorders. For those of you who don't know me, I'm a general dentist with a practice in Portland, Oregon, where we are dedicated to taking care of patients with TMJ disorders. I work here with my wonderful mentor, Dr. Arthur L. Parker. Please be sure to check out the links in the description box below if you want to hang out with me on other social media platforms, especially Instagram. I post lots of useful information on TMJ disorders, tips, trivia, muscle releases you can do yourself at home, and more. So if you like to nerd out on TMJ stuff like I do, be sure to check out those links. So let's get right into it. At my TMJD only practice, patients present with a wide variety of symptoms, ranging from mild jaw pain and infrequent clicking and popping to severe headaches, jaw pain, ear pain, constant clicking and popping with pain, locked jaw, and more. For our patients, we diagnose based upon perceived degree of difficulty, with 4 levels, 4 being the highest. For more information on this, be sure to check out my video called The 4 Treatment Levels, which I've linked above. For all 4 of these treatment levels, we treat with custom orthotics, myofascial release, and osteopathic manual jaw manipulation as needed. For most of our patients, we make both a nighttime orthotic and a daytime orthotic, with the goal of tapering our patients off of the daytime orthotic within 12 to 16 weeks. I'll circle back around to why we taper our patients off of the daytime orthotic a little bit later in this video. The orthotics, daytime and nighttime, the myofascial release, and the osteopathic manual jaw manipulation are all considered phase 1 treatment and can take anywhere from 2 months to 6 months with weekly or bi-weekly appointments, depending on the severity of the symptoms. Phase 1 is considered over when our patients are symptom-free. No more headaches, neck pain, jaw pain, or ear-related concerns. No more joint noises, and a good, healthy range of motion for the jaw. At this point, the muscles and the joints are in a healthy and functional state. Throughout phase 1, patients may experience changes in their bite as their neuromuscular system adapts to the new healthy position of the muscles and the joints. This position is determined by sophisticated software and is where the orthotics position the mandible when worn. These changes in the bite can be non-existent, they can be subtle, or they can be drastic. That's where phase 2 comes into play. I want to take a moment here to pause and state that at my office, we only do phase 1 treatment. We refer out if phase 2 treatment is needed or wanted by the patient. Now let's move on to talking about phase 2 treatment, which we refer out to practitioners who are skilled and experienced in phase 2 TMJD treatment. Phase 2 TMJD treatment consists of creating a bite that helps to support the healthy position of the muscles and the joints. This can be done with orthodontia, braces, or full mouth reconstruction, also called FMR. Orthodontia consists of moving teeth with brackets and wires to the healthy position of the muscles and the joints. Again, this healthy position is determined in phase 1. FMR, or full mouth reconstruction, consists of placing caps or crowns on all of the teeth to build the bite back to that healthy position for the muscles and the joints. FMR is a good option for patients with severely worn down teeth from decades of clenching and bruxing activity. If phase 2 treatment is wanted by the patient or needed due to drastic changes in the bite, then it is vital to work with a skilled and experienced practitioner who understands the relationship of the bite to the temporomandibular joints and the muscles that surround and support the jaw. One question I frequently get asked is phase 2 treatment necessary? And my answer to that is, if phase 1 treatment results in changes in the bite, then phase 2 treatment is likely a good option to explore, of course with the patient's agreement and consent. At my office, we do our best not to change the bite during phase 1 treatment, thereby making phase 2 treatment optional. The way that we do this is that we ask our patients to take the daytime orthotic out when they're eating or drinking. This allows the bite to reset during the day when the orthotic is taken out. We also do our best to taper our patients off of the daytime orthotic within 12 to 16 weeks, thereby lowering the chance of the bite changing. Other offices will tell patients from the start to expect minor or even drastic bite changes, and that phase 2 treatment will then restore the bite. Each TMJD office practices differently, and there's no clear right or wrong way when it comes to treating TMJD. Another question I frequently get asked is if braces or moving the teeth will fix TMJD, if it'll fix jaw joint noises and or pain. And my answer to this is that I don't like starting TMJD treatment with braces or with moving teeth. The reason for this is something that we call the tripod effect at my office. Our two temporomandibular joints, or TMJs, and the way that our teeth fit together, like cogs on a gear. This system, it works like a tripod. What happens when you cut off one leg of a tripod? The whole system goes out of balance. For many of our patients, their TMJs, their temporomandibular joints, are already unstable when they come to see me. So that means that already 2 legs of that tripod system are out of whack. To me, it doesn't make sense to then start moving teeth, which affects the 3rd leg of the tripod without first addressing the unstable first 2 legs, the TMJs. Stabilizing the joints and bringing the muscles to a healthy and functional state first is what I would recommend. Once that's done, phase 2 TMJD treatment can start if it's needed or if the patient desires it. To review, phase 1 is all about stabilizing the joints and bringing the muscles to a healthy and functional state, eliminating pain and jaw joint noises and episodes of the jaw locking. We only do phase 1 treatment at my office. If the bite changes in phase 1 treatment, phase 2 treatment is likely a good option to explore. Phase 2 treatment consists of orthodontia, braces, or full mouth reconstruction, FMR, to build the bite to a position, a very specific position, that then supports the healthy muscles and the healthy joints. Again, this phase 2 treatment must be done by a skilled and experienced practitioner who understands and appreciates the relationship of the bite to the temporomandibular joints and the muscles that surround and support the jaw. So that's really it, my friends. I hope this video helped to explain the differences between phase 1 treatment and phase 2 treatment when it comes to TMJ disorders. If you like what you heard, if you learned something new, be sure to click like below, subscribe to my channel, do all the things, my friends. As always, questions and comments are welcome. And remember, you can never have TMI about TMJ. Thank you.